We are back on Inside South Florida. Thanks so much for watching, everyone. Now, millions of Americans could actually soon face a major increase in the cost of their health care coverage as key federal tax credits are set to expire. Without action to extend these credits, health insurance premiums could double, forcing many families to reconsider or even drop their coverage altogether. So Adam Rubin, Vice President at the Economic Security Project, joins us now to help us kind of explain these changes and what they might mean for you. So Adam, let's dive right in. Let's break it all down. What is changing this fall, and why could it mean higher health care for families?
Health insurance costs are set to double or even triple for tens of millions of people this fall, and most of them don't even know it yet. Most working and middle-class families who get their insurance through the Affordable Care Act or Obamacare, then they get tax credits that help lower the cost of that insurance. But the Congress passed a tax bill this summer that ended those tax credits. And so we're going to see skyrocketing prices this fall and millions of people who can no longer afford their insurance. November is open enrollment when people sign up for the next year and find out what they're going to have to pay. For most people, it's going to be terrible sticker shock, the largest ever premium increases. And people who are already struggling with housing, utilities, groceries, now will have to worry about healthcare costs on top of that.
Okay, a credible change, of course, coming up here. How will this directly affect individuals and families in our state here in Florida?
In Florida, the average premium increase is expected to be 132%, and 1.5 million people are expected to lose their health insurance coverage entirely between the cuts to the Affordable Care Act and Medicaid. Just to make it more specific, take a typical family in Miami, a 60-year-old couple. They're working, earning $40,000, $45,000 a year each. For a fairly basic healthcare plan, their monthly premium will increase by $2,151. What kind of middle-class family can afford that? And it gets worse because the same bill will push hospitals and clinics to close or cut back services like maternity wards, especially in rural areas. So we're going to see families starting to skip necessities or skip healthcare they can no longer afford.
Adam, let's break it down with final three things here. Tell us shortly, why is this happening now? But more importantly, what can be done about it, and where can we go for more information?
Yeah, the big bill that President Trump and Republicans in Congress passed this summer is ending these tax credits for working families and small business. That's why we're in this healthcare emergency. But the good news is these price increases don't have to happen. Democrats in Congress are pushing to extend the tax credits to bring costs down. Many Republicans are refusing. That's what's behind the government shutdown. But increasing numbers of Republicans are expressing concern about the price spikes on people in their districts. So I think the hope is that they can persuade their leadership to come together to reach a bipartisan deal to keep these tax credits going. The bottom line is we want to live in a country where healthcare is a right and not a luxury. And to find out more information, people can go to healthcare.gov to find out about the premiums in their area.
There you go. Adam Rubin, thanks so much for joining us on ISF. Hey, the good news is I heard in there's good news and there's hope. That's what we can cling to as we look to make additional change. Adam, thanks so much for hopping on to ISF.
Thank you. Appreciate it.